Unfortunately, cancer affects far too many Queenslanders. Cancer, as we know, is a terrible disease. And we know a lot of people suffer from cancers like prostate cancer and breast cancer. And I don't think it's well understood that cancer of the head and the neck is one of the most common forms of cancer after breast and prostate cancer. We're seeing increasing numbers of people contract cancer of the head and the neck, and we are very, very pleased today to announce that under a new Labor government, the PA Hospital will become home to a new research institute in head and neck cancer. Head and neck cancer is a very fatal form of cancer. We want to make sure that Queensland and Queensland patients of this terrible disease are right at the forefront of finding new treatment and new cures for these sorts of cancers. Over the last 10 years, Queensland has invested more than $3 billion into smart state facilities. Our Smart State program is delivering some of the world's best research and science. Some of the best medical science in Australia is now being done in Queensland because of our steady flow of investment. This adds to that investment. This will be a $15 million investment in a new research program into head and neck cancer. This will add on to the great work that's already been done here at the PA Hospital. The PA Hospital is home to the National Prostate Cancer Centre. It is home to a very major skin cancer and melanoma program, and it will now be home to one of the largest head and neck cancer services in Australia. In fact, there is only one other head and neck cancer program, and that's based in Sydney. This program will be a Queensland first, a unique collaboration between the PA Hospital, the Queensland Institute of Medical Research, our new Translational Research Institute, and the University of Queensland. What this centre will do is bring together the best clinicians and doctors and medical researchers from the PA Hospital with others from other research institutes to put Queensland right at the forefront of the global search for cures and treatments of head and neck cancers. This is a $15 million program. It will be funded $5 million from the Queensland Government through our Smart State Fund, another $5 million from the PA Hospital Research Foundation funds, and another $5 million from Atlantic Philanthropies, which have been so generous to Queensland in the past. We've seen a number of research institutes funded in a partnership between one of the biggest philanthropic organisations in the world, Atlantic Philanthropy, led by Chuck Feeney here in Queensland. This adds to that existing foundation that we have built steadily year on year. Head and neck cancer services here at the PA are already well established. The PA Hospital has the largest caseload of head and neck services and some of the best clinical outcomes in the nation. What this centre will do is add to their existing treatment program. These funds will work to find new drugs, new cures and new technology to investigate, treat and hopefully cure more of these kinds of cancers. One of the first things that will be part of this facility will be a new PET MRI machine. People might have heard a little bit about these machines, and I might get some of the others to explain it a bit better than I might be able to, but basically there are PET machines and MRI machines. What this will do is bring those two machines together so the images can be brought together and give a much more accurate image of what's happening. This will be the first machine of its kind here in Queensland, and it will really add to the effort being made here at the hospital to treat and understand and hopefully cure this disease. There are many people in Queensland who know someone who is suffering from cancer. It is a terrible disease. We have made some remarkable breakthroughs here in Queensland with the development of Gardasil that prevents the development of cervical cancer. We hope to be at the forefront of the fight against head and neck cancers in the same way. I thank all of the partners who have been involved in putting this program together, and I particularly congratulate the PA Hospital and all those clinical staff who have done such a great job in this area to date. It's because the PA has such well-developed expertise in head and neck cancers that we can be confident that this investment in a centre of excellence for head and neck cancer will do an amazing job here. Hopefully, we will see great things come from this. This research can find, if this research can help to provide better treatment, alleviate suffering and cure some part of this disease, then we will be making a big difference to the lives of many, many families. So I thank all the partners. I particularly thank Atlantic Philanthropies. This is a good example of partnership between government and a charitable organisation making great things happen. I might ask Professor Bill Coman to make a couple of comments from his perspective, someone who has, I should say, Professor Bill Coman has worked here at the PA in the area of head and neck cancer surgery for a very long time, and I'm delighted that he is in a position to take up the job as the director of this new Centre for Excellence. So,
thank you, Premier. This hospital treats over 500 new patients each year, and a couple of thousand old patients with head and neck cancer, and it's been building up this caseload because of two factors. One is the results from this hospital have been outstanding, certainly world class. The second is that there is an increasing incidence of head and neck cancer in the younger age group, and this is related to the HPV virus, some 35 to 50% of cases now appearing in people in their 30s, 40s. Previously, head and neck cancer was a disease that affected drinkers and smokers and came on in their later life. So this institute will allow us to investigate further the HPV virus, the vaccine for which was developed by Professor Ian Fraser, and it will allow us to investigate the transmission and the prevention and a better cure for these diseases.